11 years she's been with them now.
Yeah.
But recently, it was World Diabetes Month as well as Universal Children's Month. So there's a new type 1 diabetes registry now, along with the Ministry of Health, that Royal Health Awareness Society has done. So Ms. Lina Tarazi is a type 1 diabetes project manager at Royal Health Awareness Society. And
Yeah.
first of all, welcome to the show.
Thank you. Good morning, Tim. Thank you for considering us in this interview and for your interest actually in our work.
Of course, I have family members as well. I was just telling you they struggle with diabetes.
Everyone
so
has.
yeah, it's very close
Yeah.
to me as well.
Yeah.
Can you tell our listeners just a little bit about the core mission of Royal Health Awareness Society and what this, it's been 20 years, what that signifies for the organization?
Yeah. So the core mission of the Royal Health Awareness Society in Jordan is to promote health and empower people in Jordan to adopt healthy lifestyle and behavior. We focus on prevention, awareness, and community level initiatives that lead to sustained positive health changes.
Mm-hmm.
And the 20th anniversary signifies two major things. First, we're celebrating 20 years, 2 decades of dedication, successful partnerships, measurable impact across the kingdom. And second, we're launching the new strategy for us, where the focus and our contribution will be committed to a healthy life course for all people living in Jordan.
And your organization, too, the Royal Health Awareness Society, is something that is needed because people don't often know what resources are available or even what prevention measures they should be taking, lifestyle changes
Sure.
they should be making. Now, recently, I know you set up a national registry
Sure.
for the National Type 1 Diabetes Registry in coordination with the Ministry of Health.
Sure.
What foundational role did the Royal Health Awareness Society play in establishing it? I know it was launched on World Diabetes Day, right?
True,
Yeah.
the 14th of November.
Uh-huh.
Worldwide, we celebrate the World Diabetes Day, which is globally significant because it is dedicated in raising awareness about the disease that affects hundreds of millions around the world. It provides a crucial platform and advocate for growing epidemic and advocate for a better prevention and management strategies. For Jordan, the day is especially important this year as part of a project that has been implementing 4 years ago. We started the work like for more than 12 months on the registry, the National Registry for Type 1 Diabetes. By holding the official launch of the National Registry of Type 1 Diabetes and celebration of World Diabetes Day on the 14th of November, we're sending a powerful message that our commitment goes beyond simple awareness campaigns and projects. We are delivering tangible tools and infrastructure to strengthen the healthcare system and directly support the large segment of our population living with this chronic situation.
We're talking to Ms. Lina Tarazi, who is the Type 1 Diabetes Project Manager at the Royal Health Awareness Society, about the new Type 1 Diabetes Registry that's now nationwide here in Jordan. So specifically, if someone's listening to this thinking, okay, we're going to register everyone that's suffering from this, and I know it affects the younger ages in more significance maybe even than the older ages. But what are some of the benefits of the establishment of this? How will it benefit people?
Yeah, so in simple terms, what is a national registry? Let's start from there. A national registry is a centralized, reliable database that collects essential, comprehensive information about every person living with this disease. What is the condition, the case, their geographical distribution, their needs, and everything towards information that may help healthcare providers to provide better services for these people.
And more efficient, too.
Yeah, it is efficient.
Yeah.
RAS is very proud that the registry was built as a major strategic partnership with the Ministry of Health, with the support of the World Diabetes Foundation, and with great contribution and collaboration from a wide range of national entities and organizations who are focused on this matter. From both the academia and the medical field. And this collective effort formed the National Registry Committee, who had the privilege to work on this matter to serve and provide a tool for Jordan, let me say, and for all people living with this matter. The expertise and the vibe these people in this committee provided to design the registry gave it a scientific background, and the operations in Jordan took it to another level of efficiency.
It's so encouraging too to see the effort that people in different sectors are putting into just increasing awareness and increasing opportunities in this kind of area.
Yeah.
And I know you've been working on it for a long time too.
Sure.
So congratulations on that.
Thank you.
Looking ahead, what do you think is one of the most important long-term impacts that this registry is going to have on the lives of people with type 1 diabetes here in the kingdom?
So I'll go back a bit to the core goal of our project, Type 1 Diabetes, is to destigmatize the disease. Usually people get diagnosed in very early age of their life, which is the school age. So the stigma is very high, and most of the times parents and the kids suffer on how to deal with the case, and how to manage, and how to be vocal about it, actually. How to tell that I am type 1 patient and I have some special needs to maintain a healthy lifestyle and to function, actually. So on the long term, the registry will provide an important evidence-based policymakers' decision and efficient resources for allocation. And here we're talking, for example, for the Ministry of Health, the data from the registry is a non-negotiable in a way or another. It's a tool that will enable them to formulate policies and laws that are based on documentations and cautious figures. It will provide a tool to reduce misuse or waste and distribution of medications and supplies. And here I want to thank Ministry of Health. As in Jordan, the rule says every person in Jordan living with type 1 diabetes is covered with their needs of insulin and the tools for measurement till the age of 16 or 18. And the registry as well will ensure resources for distributed effectively for the most needs of tools and medications for diabetic people, beside providing a resource for researchers and medical field to rely on in their researches.
Just a couple of quick questions, too. For people with type 1 diabetes, are they automatically registered on this list, or can they opt out? Or if they have questions about that, can they contact the Royal Health Awareness Society?
Definitely, sure. So the registry is owned by Ministry of Health, RAS, and Electronic Health System entity, Hakim, are both on board to support and help every people or everyone who's living with this case.
Okay, great. All right, Ms. Lina Tarazi, who is the Type 1 Diabetes Project Manager at the Royal Health Awareness Society. Did we cover everything? Is there anything else you wanted to mention before we go?
We're always here whenever you feel like continue talking about diabetes and type 1 in specific. I think we covered everything now.
Is the best way to contact you through the website, or is there a hotline for the Health Awareness Society?
Actually, we prefer the website. Our social media handlers are very active as well on Facebook, Instagram, and LinkedIn.
Great. Well, thank you very much for coming around and telling us about this. First of its kind. It's a Type 1 Diabetes National Registry with the Royal Health Awareness Society and also the Ministry of Health. Ms. Lina Tarazi, thank you for all your work on that.
Thank you. Thank you so much for having us today.
It's a great initiative. For those struggling with Type 1 diabetes here in Jordan, so much great work being done. Thank you again.